Alrighty, been having some technical difficulties here, folks, so let's hope that the third time's a charm. All right, now in this next couple of video segments, I want to discuss the autonomic nervous system, the role that it plays in our body, and essentially the anatomy that allows it to play its role. Now, the autonomic nervous system, remember, we would more often than not classify this as part of the peripheral nervous system, and remember, part of that visceral motor system. Remember when we divided the nervous system into different parts? We said there's somatic motor, visceral motor. Okay, this is a division of the nervous system that is essentially that is innervating all of the involuntary functions of the human body. Okay, because remember, when you see the word autonomic, you should think automatic. Okay, and when we say automatic, what we're saying is unconscious. Okay, unconscious. So this is all activity that's regulated via reflexes. Okay, now there are some exceptions to this, but for the most part, that's how I want you to think about how the autonomic system works, the automatic nervous system. Okay, just in mentioning that right now should be fairly easy to understand. What are the main components that this division of the nervous system innervates? Because remember, we talked about the somatic, the somatic motor aspects of the peripheral nervous system. You're thinking skeletal muscle, peripheral nerves that innervate skeletal muscle so we can move. Okay, essentially, what the autonomic nervous system is innervating is smooth muscle and glands. Okay, smooth muscle and glands. Okay, also cardiac muscle as well, because remember that's involuntary. All right, and the activity of all of those involuntary tissues essentially sums up what we do on a day-to-day basis, and a lot of that is regulated through a lot of work between the combination of autonomic reflexes and then some control from higher up in the brain that can help regulate autonomic activity as well. So I'll talk more about that towards the end, how we regulate the activity of this system. Okay, so the automatic nervous system, autonomic. So essentially what I want to cover is I want to start out by briefly introducing a little bit of new terminology that's going to go with, and that's going to be imperative to understand the autonomic nervous system. And then we'll go into an anatomy review, and then that'll probably take me through this first video, so an intro into terminology and reviewing the basic anatomy of these. And then we'll jump into the next video. I want to talk about this especially here is going to be relatively important. Granted, all this is important, but understanding receptors and neurotransmitters that are involved. I'll briefly introduce some of the neurotransmitters in here in this first video, but understanding which neurotransmitters elicit which effects. Okay, because if you really gain a good understanding of receptors and transmitters involved with the autonomic nervous system, that'll be a good head start into understanding some basic pharmacology. Okay, like for example, you've probably heard of some drugs called beta blockers. Okay, those are, we're blocking. Now think about that, beta blockers. We're obviously blocking the activity at something, and we're blocking activity at what are called beta receptors. Okay, so like I said, I'll go more into the applied aspects of that in the next video, but there's just something to think about. So like I said, there's a lot of drugs out there that directly affect this nervous system that you guys are going to encounter in your everyday profession, regardless of what level of medical professional you're going to school to become. Okay, or you more than likely know somebody that's on one of these kinds of drugs as well. They're fairly common. Okay, and then I want to talk about some just basic applied physiology with this system, and essentially realistically talk about stress. Okay, stress and the fight or flight response, because that's essentially what the autonomic nervous system is designed to do. It's designed to prepare the body for stress. Okay, and and it does this by using two different, I should say, to prepare the body for stress and to recover from stress. We could say also mobilize. Okay, mobilize the body for stress, and essentially to allow us to recover from that, because there are, responding to stress, especially extreme stress, is very taxing on our physiology. Okay, I mean, you guys can understand this. I mean, when you get stressed out, whether you're driving down the road and someone cuts you off, you bump into a bear in the middle of the woods, or you're just a high stressed individual, okay, you're gonna not, you're not gonna have an appetite for a while. Then all of a sudden, you're gonna want to eat like crazy because you burned out a lot of calories. Okay, so yeah, so it's one thing to think about then, as when we have to get out of a stressful situation. Okay, the events that take place, and then also the repercussions of too much stress as well. All right, so that's essentially that's realistically what the autonomic nervous system is there to do for us. Okay, I mean, help us regulate levels of, help us deal with stress. Okay, like I said, mobilize the body for stress, and then allow us to recover from the mobilization. Okay, and some terminology to understand then that will correlate with your understanding of how the autonomic nervous system allows us to deal with stress. Okay, one, we would have to break the ANS down into two separate divisions, and what we call the sympathetic division, the SNS, and the parasympathetic, what we call the PSNS. Okay, sympathetic nervous system and the parasympathetic nervous system. Okay. And we'll see in a moment how we identify these two systems. I mean, they're both part of the same autonomic nervous system, but they're anatomically separate from one another. They're anatomically different, and they. Now, one thing you have to remember about these two divisions is that they antagonize one another. Okay, they antagonize one another, meaning they work opposite. Okay, they work against one another. Okay, so basically what you should think then is one division will elicit one type of response, and the other will elicit the exact opposite type of response. Okay, the sympathetic nervous system is what is the mobilization, okay, part of the autonomic nervous system, and then the parasympathetic is the recovery. All right. So when we encounter a high stress situation, the activity, when we encounter a stressful situation, like I said, let's say you're driving on the road and someone cuts you off. Okay, someone cuts you off and you don't want to get into an accident. You hit the brakes and you white knuckle the steering wheel, and all of a sudden, you feel some changes take place in your body. Okay, some of those changes you feel are increased heart rate and increased breath rate. It feels like your vision and perception of the world has improved because your pupils dilated. Okay, and so on. All right, we can sit here and list a bunch of different effects, but I'm not going to do that right now. Okay, but you get the picture. That was the activity of the sympathetic nervous system. Okay, getting ready. Plus, you're going to feel a little jittery as well because this, the sympathetic nervous system, is also going to, help reroute blood flow to skeletal muscles. Okay, so you're going to feel a little jittery or anxious or like you're ready to, I don't know, hit the gas or drive harder or do something crazy because of the increased blood flow to your skeletal muscles. Okay, so essentially what you're doing is you're mobilizing your body to either get out of a stressful situation. Okay, that's why we call it fight or flight. Okay, we basically increase activity to allow us to fight or run. All right, and then when you're driving on the road, that person cuts you off, you slam on the brakes, and then all of a sudden, after a minute or so, you're starting to relax, calm down again. Now you've got the activity of the parasympathetic nervous system taking over. Okay, and the parasympathetic nervous system, that's where the antagonist aspect comes in, is basically carrying out the exact opposite effects of the sympathetic, lowering heart rate, lowering breath rate, okay, constricting pupils. Oops. Okay, constricting your pupils. All right, rerouting blood flow back to your core organs, your gut, essentially. All right, so we can recover from this. All right, so basically now this is something to kind of pay attention to, and I mentioned this as well. Notice that both of these divisions, even though they carry out, their effects are opposite of one another. Okay, notice that these effects take place within very similar organs. Okay, this is a concept which I forgot to type this on here. This is a concept that we call dual innervation. Dual innervation. Okay, dual innervation. So what we mean when we're saying dual innervation is that both the sympathetic nervous system and the parasympathetic nervous system are innervating the exact same organs, okay? It's just that in certain situations, okay, one of these are going to dominate activity over the other, okay? You know, for example, when we're experiencing stress and we need to get out, the sympathetic nervous system is going to take control. And then when it's time to recover, the parasympathetic nervous system is going to take control, okay? You know, and I'll talk more about how this is controlled, okay, in another video, but this is something to think about, okay? The concept of dual innervation, that sympathetic and parasympathetic nervous systems innervate. There are exceptions to this, but like I said, I'll go over those later on, okay? And then the words adrenergic and cholinergic, okay? So what you should be doing is you should associate, primarily associate adrenergic with the sympathetic nervous system and cholinergic with the parasympathetic nervous system, okay? So when we say adrenergic, we're essentially, what is that? Well, think of that for a second. Adrenergic. What does that word even sound like to you? What does that sound like to you? I'm assuming you guys are thinking adrenaline. Okay, if you're thinking adrenaline, sure. Okay, now basically what we're saying here, when we're saying adrenergic, we're saying that the neurotransmitter norepinephrine, okay, is what's responsible here. Okay, then when we're talking about the parasympathetic nervous system, we're talking about the neurotransmitter acetylcholine. Okay, the neurotransmitter acetylcholine. Okay, so when sympathetic nerves want to basically elicit their effects on an organ, in which you're noticing a pattern here, essentially increase activity of the tissue. Okay, those sympathetic nerves will release the neurotransmitter norepinephrine, and that'll essentially increase activity, increase the metabolic activity of that tissue. Okay, and then acetylcholine. Now remember, we talked about skeletal muscles. Okay, we talked about how acetylcholine is designed to make a skeletal muscle contract. Okay, but you got to remember, these nerves are not innervating skeletal muscle. These are innervating smooth muscle and smooth and cardiac muscle. Okay, so acetylcholine is going to elicit different effects on those tissues than it's going to on skeletal muscle. Okay, and essentially think of it not necessarily as inhibitory, but as relaxing or recovering type effects. Okay, because I don't want to say inhibitory because it's not going to stop the functions of that tissue altogether. It's just going to slow it down. Okay, so adrenergic and cholinergic. Okay, and then there are receptors that are also very specific to these two neurotransmitters, and I'll talk about those in the next video. But just for now, associate adrenergic with sympathetic nervous system, cholinergic with parasympathetic. Okay, and then when you start to look at especially the distal aspect of the parasympathetic nervous system, all right, what's going to happen is once these nerves get into tissues, they're going to start to branch and form these diffuse networks inside the tissues that they innervate. And then all along these diffuse branches, okay, inside the tissues, they're going to be these kind of bulbous, or these button-like structures, boutons that are on there. Okay, that store the neurotransmitters that are to be released, and those are what we call varicosities. Okay, varicosities. All right, and you'll see that again, later on when I talk about the neurotransmitters and so on. But this is some good terminology to start to get acquainted with when it comes to understanding the role that the sympathetic nervous system plays in our body. All right. So now next, let's talk about the layout of the two different divisions of the sympathetic and parasympathetic nervous system. All right, so this would be essentially the sympathetic nervous system. All right, the SNS, and you have to really pardon my art here, people, or folks, not people, sorry. I don't know. Just like I said, hopefully you've got a textbook or something open in front of you and you can see better images than this. All right, but what we're looking at here is a very poorly drawn version of the sympathetic nervous system. Again, I'm not very keen on my art here. So now, when we look at the layout of the sympathetic versus the parasympathetic nervous system, what you're going to see is you're going to see some differences. Now, what's different, one of the big differences about the autonomic nervous system in general compared to the somatic, the motor neurons that you're thinking about that make skeletal muscles contract, is that these operate in two neuron pathways. Okay, they operate in two neuron pathways. Okay, whereas a somatic motor neuron going to a skeletal muscle is going to be one neuron. Remember, you're going to have you would have a cell body, within the spinal cord, more towards the ventral horn, and then the axon from that's going to branch all the way out and then go to the muscle that's going to innervate. Okay. Now, what happens here, with both the sympathetic and parasympathetic nervous system, is these work in two neuron chains. Okay, two neuron circuits, I should say. All right. So that's one big difference between the somatic and the autonomic nervous systems. Okay, that also the neurotransmitters that are used. Sorry. Now, when we look at the sympathetic nervous system, so one thing you'll notice when you take a look at the spinal cord. Now, bear in mind, before I talk about this object you see here that's called the sympathetic chain. Okay, this is found on both sides of the spinal cord. I only drew it on one just because I don't need to torture you guys with that much of my art. Okay, and if you get the picture and understand how one side works, the other side's the exact same. Okay. Now, what you'll notice here is that there are these ganglia. Okay, there are these ganglia that essentially run parallel with the spinal cord, and they're what are called paravertebral ganglia. Okay, paravertebral ganglia. Para meaning around, and then vertebral. Okay, is vertebrae. Okay, so these are found just on the outside of the spinal cord. All right. Now, remember when I showed you in the previous video the general anatomy of a spinal nerve? You got to see the vertebrae. You got to see how they form the foramen. The intervertebral foramen, and then the nerves exit out. Okay, just along the outsides of these foramen where the nerves are branching out, there are these ganglia that are found up and down the, like I said, parallel with the vertebrae along the spinal cord. Okay, that's why they're called paravertebral, not paracaudal. Okay, because they're not aligned, they're not right next to the spinal cord within the vertebrae. They're outside of the spinal cord, lined up along the outer aspects of the vertebrae themselves, hence paravertebral ganglia. Okay, and little terminology review, remember the word ganglia, or ganglion. It's a cluster of nerve cell bodies. Oops. Okay, it's a cluster of nerve cell bodies. Okay, so what we're saying here is that there are two neurons that are interacting with one another. Okay, now, these divisions of the sympathetic nervous system, okay, essentially begin at T1, okay, and go all the way down to L3. Okay, now, T1 to L3. Now, what can happen, what happens then are you've got what are called these preganglionic and postganglionic fibers. Okay, so from the spinal cord to the sympathetic chain, those are what we call preganglionic, and then from the ganglion out to whatever tissue is being innervated, that's what we call postganglionic. Okay, so this would be the first neuron, and these would all that you see out here would be the second neurons. Okay, that are found, within the organization of this. All right. Now, when it comes to how the sympathetic nervous system works, essentially there are the direction that these preganglionic fibers can go are essentially a couple different directions. Okay, one, they can travel out from the spinal cord right to the parallel segment right to the parallel ganglion along the spinal cord, as you can see here. Okay, along the sympathetic chain. Okay, so a preganglionic neuron can go right into the parallel ganglion and then activate a postganglionic nerve out that branches out to a tissue somewhere. Okay. what can also happen are these preganglionic neurons. I don't really have this drawn on here. You can kind of see right here. Should have made these green. Okay, you can kind of see right there. All right, that some of these may enter they may branch out to a parallel segment, of the sympathetic chain, and then they may travel upward. Okay, they may either travel up or they may travel down the sympathetic chain. Okay, and then they may activate a sympathetic nerve, a postganglionic nerve, either above or below the segment of the spinal cord that preganglionic nerve originated in. All right. The other direction, so we've got right out parallel, we've got these preganglionic fibers traveling up or down the sympathetic chain, or what they can do, they can pass, almost essentially pass right out of these preganglionic nerves can pass right out of the chain and then out to these collateral ganglia out within the body. Okay, and there are a couple different ganglia that are found here. All right, and we've got out in the body. And one of these collateral ganglia would be called the celiac plexus. The celiac plexus, all right, and then we've got the superior mesenteric plexus. Okay, and then we've got the inferior mesenteric plexus. I'm just going to abbreviate that. Okay. Now, I've seen some books just combine these two together and call it the hypogastric plexus. The hypogastric plexus. So that's just going to depend on what book you're reading. Okay. Now, what does that tell you then about the sympathetic nervous system? It's able to reach out to many different tissues because of the ability of these preganglionic fibers to pass, like I said, either parallel right into a parallel ganglion of the, a parallel bulb of the ganglion of the sympathetic chain. They're able to pass up and down, or they're able to pass out to these collateral ganglion, and essentially that allows the sympathetic nervous system to reach out to a lot of different tissues. Okay, now. And then, obviously many different tissues will be innervated, such as the eye. Okay, these two would be salivary glands. Okay, this would be the heart. All right. Here you're looking at the... missed a couple. These would be the lungs. Okay, essentially the bronchial tree in the lungs. Okay, here you're looking at the stomach and small intestine. I'm just going to abbreviate this, small I. All right, here you're looking at the colon. Okay, here you're looking at the lower parts of the colon and the genitals. Okay, with the inferior mesenteric plexus. Pardon my handwriting. All right. Now, what this is down here, this is the adrenal medulla. Okay, this is the adrenal medulla. Remember, the word medulla means middle. Okay, and if you look at the, the basic functional anatomy of the adrenal gland, it has a cortex and a medulla. Okay, now within the medulla, okay, in the inner workings of the adrenal gland, there are hormones that are released out of there called catecholamines. Okay, catecholamines are the high-class term for adrenaline. All right, now the two catecholamines that are going to be released, I'll summarize that in a little bit, are going to be epinephrine and norepinephrine. Okay, now you just heard me say earlier that norepinephrine was a neurotransmitter used in the sympathetic nervous system. One thing you have to bear in mind is that there are many hormones that also act as neurotransmitters. Okay, if a hormone, because you have to remember they're both just chemical messages. Okay, if it's being released from a gland, it's going to be a hormone. If it's being released from a nerve, it's going to be a neurotransmitter. Okay, so that's something to keep in mind. Okay, so again, in a nutshell, what you can see here is the sympathetic nervous system reaches out to many different tissues. Okay. Now, let's kind of take a look at one thing I wanted to mention as well that's a little different about the the thoracic spinal cord. Okay, the region of the spinal cord that pass down thoracic vertebrae have these lateral bulges, or what we call lateral horns. Okay, so remember, this is gray matter in here, and this is all white matter, surrounding the gray matter. Okay, within the lateral horns, okay, that's where these preganglionic fibers begin. Okay, and then they pass out. Remember, any kind of output out the spinal cord exits out the ventral aspect. Okay. So that's something to keep in mind as well, that these preganglionic fibers are found in the lateral horns, okay, of these thoracic vertebrae. All right, again, I forgot to mention that in the previous video that I just made. Now, the parasympathetic nervous system, essentially, essentially this is more, this begins more in your head and in the sacral region. Okay, the head, and that's why they would say that this is craniosacral in nature. Okay, whereas the sympathetic nervous system, we would say is thoracolumbar. Okay, now what you're noticing here is that the bulk of the parasympathetic nervous system comes from cranial nerves. Okay, so essentially the parasympathetic innervation to the eyeball, in essence, comes from cranial nerve number 3. Okay, the innervation of, again, more salivary glands. Okay, again, more cranial nerves, cranial nerve number 7. Okay. If you're looking at, again, more cranial nerves, innervating, more salivary glands. I'm not going to go into the specifics here. You guys can, take a look at that in your reading. All right, and this is what's called the ciliary ganglion. Okay, the pterygopalatine ganglion. You got to say that one kind of slowly, the submandibular ganglion, and then the otic ganglion. Okay, so basically, parasympathetic innervation to the head comes from cranial nerves number 3, cranial nerve number 7, okay, and cranial nerve number 9. Okay, and again, by now you guys better know what the heck these cranial nerves are by their numbers. All right, and then we've got, so that's parasympathetic innervation to the head. Okay, and here this would be the midbrain. Oops, midbrain. This would be your pons, and this would be your medulla oblongata. All right. Now you can see that we've got cranial nerve number 10, okay, which is otherwise known as the vagus nerve, okay, branches down from the head down to the body. The vagus nerve is by far the largest and most far-reaching cranial nerve, okay? In fact, it's the only cranial nerve, remember, that branches out outside of the head, neck, and upper shoulders area. All right, the cranial nerve goes down and innervates the heart, the lungs, okay? So it influences activity of the heart, okay, lungs, more specifically the bronchioles, all right, your stomach, all right, small intestine, I'm just going to abbreviate that again, your colon, all right, your urinary bladder, and, reproductive areas as well, or genitalia. Okay, so the vagus nerve essentially innervates from the heart to the colon. Okay, not all aspects of the colon, but a good portion of it. Okay, more the upper aspect of the colon, like the ascending colon, for example. All right. Now the pelvic splanchnic nerves, these originate from the sacral vertebrae. or sacral regions of the sacral vertebrae, sacral aspect of the spinal cord, okay, to form what are called the pelvic splanchnic nerves. And then these are what innervate the, like the descending colon, the sigmoid colon, the urinary bladder, and the genitalia. Okay, so in a nutshell, we've got your parasympathetic nervous system here. So, and again, notice, when you went back and saw the previous picture, as poorly drawn as it was, okay, you'll notice that, innervation of the eye, salivary glands, the heart, okay, stomach, small intestine, colon, okay, the genitalia. What'd you notice here? The eye, salivary glands, the heart, the lungs, small intestine, colon, urinary bladder, genitalia. Notice the pattern here. Dual innervation, as I just mentioned before. Okay, dual innervation. And like I mentioned before, like I said, even though these two systems antagonize one another, like I said, there are certain situations when one will be more active than the other. All right, so if you're in a situation of high stress, okay, this parasympathetic nervous system, will be overridden by the sympathetic nervous system. Okay, and then these postganglionic nerves are going to release, norepinephrine, and then you'll see some very similar effects. Like, think about it: dilation of the pupil, okay, decrease in, secretion from salivary glands, increased heart rate, decreased activity of the, essentially of the celiac and splanchnic regions, okay. And bear in mind, what are these nerves essentially innervating? Smooth and cardiac muscle. Smooth and cardiac muscle. Okay, same thing with the with the parasympathetic nervous system. What do you notice we're innervating? Smooth cardiac muscle and glands. Okay, and glands. Same thing with the sympathetic. All right, hence that dual innervation that we were mentioning. When we're talking about the lungs, we're talking specifically the bronchioles. Okay, the smooth muscle. The airways, the small airways of your lungs are aligned with smooth muscle. Okay, so we're either going to constrict or dilate. All right, pretty simple. All right, I know this looks like a mess here, but it's really easy to understand how the system works. I mean, if you have this basic understanding of the anatomy of this, okay, and then the neurotransmitters and the control and so on. All right. Now, there are some differences, if we kind of compare and contrast, not just the somatic versus the autonomic nervous system, but just the different divisions of the autonomic nervous system as well. All right. So first, let's take a look at, again, here's a somatic motor neuron. Okay, a somatic motor neuron. Okay, it's going to have, remember, this cell body is going to be located within the spinal cord, okay, and then you're going to have a long, very large, heavily myelinated axon branching out to a smooth skeletal muscle. Okay, and then this nerve and its synaptic terminals is going to release acetylcholine. Okay, now acetylcholine, all right, acetylcholine essentially always binds to what we like to call nicotinic receptors. Okay, nicotinic receptors. Okay, nicotinic receptors. Okay, so then acetylcholine plus nicotinic receptor on a skeletal muscle, you guys know what happens there. The muscle is going to contract. Okay. Now notice a pattern down here. Okay, so these would be the preganglionic nerves. Okay, preganglionic. All right. So and then the neurotransmitter that's going to interact with nicotinic receptors is going to be acetylcholine. Okay, so what's the pattern you're noticing here? Acetylcholine plus a nicotinic receptor equals activation. Okay, acetylcholine plus nicotinic receptor equals activation. So when we're in a situation of high stress and the higher brain centers say, okay, we need to get out of the situation, like I need to outrun this bear or outrun whoever I'm with, you're going to, they will mobilize the sympathetic nervous system, okay? And what'll happen is these preganglionic neurons will start to release acetylcholine. It'll bind with these nicotinic receptors, and then that will activate the postganglionic nerves. Okay, and then the postganglionic nerves are going to secrete norepinephrine. Okay, norepinephrine. Now, let's talk about this for a second. Norepinephrine. What's this going to do? What do you think norepinephrine is going to do? You know, I'll let you guys think about that for now, because I don't want to start stepping on my toes in the next video. But you know, think about this. Let's say this is you know, let's say we're talking about the eye or the heart. Okay, the eye or the heart. Let's think about that. Okay, what's going to happen when norepinephrine interacts with either these alpha or beta receptors in these certain locations? Okay, now the sympathetic nerves can also innervate these. This would be sweat glands. Okay, sweat glands. Now the letter M. Okay, the letter M, that stands for muscarinic. Okay, muscarinic, and the neurotransmitter here is acetylcholine as well. So this is the only situation. This is the only situation when you're going to see the SNS, okay, secreting acetylcholine, okay, interacting with these muscarinic receptors. Okay. Excuse me. Now, when it comes to glands, okay, this, the combination of acetylcholine and muscarinic receptors on glands is excitatory. Okay, is excitatory. So you can do the math here. I mean, think about this. You don't even need me to really go in depth with the explanation of this, because you've all experienced this at some point in time. What happened when you were in a really heightened state of being nervous? You started to sweat. You started to sweat. Okay, so this would be the only situation, again, in when the SNS is going to be releasing acetylcholine. Okay, so what'd you notice here? Preganglionic nerve, postganglionic nerve. Now remember, in the sympathetic nervous system, preganglionic neurons are short. Okay, postganglionic, long. All right, and it's the exact opposite with the parasympathetic nervous system. Preganglionic nerves are long. Postganglionic nerves are short. Okay, I mean, they may be extremely short within the tissues, because remember, we talked about those branching bodies and the varicosities that are found within these tissues. So what you might see is you may see this very, very long preganglionic nerve. I mean, remember, we're talking about the vagus nerve before. We're talking about a cranial nerve branching down from your medulla and going to your heart. Okay, the endings of that nerve are going to be right in the tissue itself. Okay, are going to be right in the tissue itself. All right. So, and then again, remember, these are going to be, you're going to associate acetylcholine with the parasympathetic nervous system. Okay, acetylcholine is the neurotransmitter here. Now, but when we're talking about acetylcholine with the heart and smooth muscle, okay, it's going to have inhibitory. Okay, inhibitory, or what you might want to think of as relaxing, okay, effects on those tissues. Okay, so it's going to make smooth muscle relax. It's going to make the heart rate go down. It's going to make the bronchioles constrict, and so on. Okay, so that's something to think about. And then the adrenal medulla. Okay, the adrenal medulla has a unique innervation when it comes to the autonomic nervous system, because they're essentially, this is the only really time in the autonomic nervous system when you're going to see essentially one nerve to a tissue, like a somatic motor neuron. Okay, when we need the adrenal medulla, that is, that's an extreme situation. When we need the adrenal medulla, that would be extreme stress. Okay, I mean, like fighting for survival. When I say, like the car accident thing possibly, or like I said, encountering a bear in the woods. Okay, you've got two options in that situation. I mean, if the bear isn't going to leave you alone, you either have to run for your life, or you have to relax, or not relax, but you have to fight. I mean, realistically, or this is when you would hear about. This is one of those situations when you hear about people with these superhuman feats of strength. Okay, for example, so when we're in a heightened state. Okay, when we're in a heightened state, the sympathetic nervous system is going to release acetylcholine within the adrenal medulla, and then that's going to automatically stimulate the release of epinephrine, norepinephrine, okay, both catecholamines, or what we call adrenaline, okay, and adrenaline is essentially just going to heighten the effects of just regular sympathetic activity, okay. You're going to see extreme vasoconstriction, okay, and smooth muscle to your core areas of the body. You're going to see lots of blood flow to muscle. You're going to be burning through a lot of energy, but the problem is, so like when you hear about someone gets into a car accident and a person picks up a car off of a person, they have this heroic superhuman strength. That was because of the activity of these catecholamines. Okay, now the problem with this now is, well, or at least what they don't hear them talk about, is that once these people are done with this, they're hospitalized. Okay, you don't just flip a car around and have this superhuman strength and expect nothing bad to happen to you, because think about this. I mean, if you're generating enough muscle strength to pick up a car, to flip a car off of somebody, you're probably going to be ripping tendons and muscles apart. You're not supposed to be generating that kind of force. Even though muscles are capable of doing so, we don't do that because we don't want to rip our tissues apart. Okay, same thing with cutting off blood flow to your let's say, I don't know, your kidneys or your stomach. Okay, if you're in this really heightened stressful scenario and you don't recover well enough, you might develop a big ulcer in your stomach because it became ischemic, it's severely ischemic, or you may have kidney damage due to the extreme ischemia because you rerouted blood flow to your, in such an extreme fashion to your skeletal muscles. Okay, so I mean, you never hear about really the bad clinical side of people doing these heroic things, but I mean, it's good, but at the same time, they're also bad. So like I said, we mobilize this in extreme situations. All right, now in the next video, I want to talk about essentially the receptors and neurotransmitters a little more in depth, and then apply that, to some, just again, to some basic pharmacology, and then the fight or flight response. And if you folks have any questions, don't hesitate to ask.